A little bit of nipple tenderness is normal in those first few days while you're establishing feeding with baby. However, if that becomes a problem or you're dreading the next feeding coming round, then have a look at your position and attachment. If things are still hurting, then please pick up the phone and speak to one of the infant feeding team, and we can either talk you through over the phone about how you should be positioning baby, and if we're worried and you're worried, then we will ask you to come in for a one-to-one appointment with us. Some of the other things you can do to help with sore nipples as well is when baby's finished feeding is just to hand express a little bit of your own breast milk and just pat it over your nipples and let it air dry, and then whatever ointment or creams you've got, just put a tiny little bit of that cream over the nipple, because this can help just keep them really healthy. One of the other things you can do as well is with your breast pads is making sure that you change those regularly, because the last thing you want is them to be too damp against the nipples, because that can cause quite a few problems if you leave them there for a long period of time. And the other thing to look at is that position and attachment is going well, because that is most of the time that is the problems that you have from your nipples, is that baby's not quite getting a wide enough mouth and is catching your nipple as they're latching on. Sometimes you may experience having a little red patch on your breast at some point around the breast, and that can indicate that you might have a blocked duct there. The thing is, don't panic. Just scoop baby up and get them to feed from you, because they're the miracle workers. They can really get rid of that blocked duct. And sometimes one of the things you can do is just to alter positions as well, just so that they're working that part of the breast where that redness is, because their little chin will do a lot of work there to unblock that blocked duct for you. If the redness on your breast starts to spread, that could indicate the start of mastitis. So if you're also feeling a bit unwell, a bit flu symptoms, a temperature, and also feeling shivery, then that might be the time to ring the GP, because you might need to get some antibiotics to help clear the breast. But the most important thing is to keep on feeding baby, because it's baby that will help clear that breast as well. So one of the common problems for mums is sorting out about going back to work, and that needn't be a problem. It just depends how you want to manage your breastfeeding when you go back. So it's always important that you can get some advice from us and talk to us about how you would handle that, because that's what we're here for as well. And you know, a lot of the times mums decide that what they're going to do is they'll feed first thing in the morning before they go to work, and then they'll be with their childcare provider, and then when they get home they'll have that lovely feeding with them when they get home from work. So it doesn't necessarily mean to say that it has to be the end of your breastfeeding journey. Sometimes, depending on the kind of birth that you've had, you might have had a delay in your lactation for a lot of mums. But don't worry, because there are loads of ways that you can encourage your milk supply. One of those things is to have lots of skin to skin with baby, so that they're near to you and they can snuggle next to you. One of the other things you can do is also to have what we call a baby moon. A baby moon is lovely. If you've got a supportive partner, you can take yourself off to bed, lots of snacks and drinks, and just have lots of skin to skin with baby and let them nuzzle and root onto your breast as much as they want to, because every little bit of stimulation your breast gets is going to encourage your milk supply. Along with that, it's also good to do some extra expressing, because this also can start to encourage your milk to come through and to increase. For some mums, they might also like to take a herb called fenugreek. Fenugreek is a really powerful herb, because with a regular stimulation of baby or by a pump, this can increase your milk supply within about 24 to 72 hours. So position and attachment is a really important part as well to encourage milk supply. So it's really important that babies get a really good deep latch on you, because whatever baby can take off, you'll make that milk again, and that's how you can increase your milk supply.